Go.
Welcome to Variation with Vignettes. This is a panel discussion. This is actually the third iteration of this type of panel. The previous years, we had different panelists looking at video vignettes from different therapeutic perspectives. For this year, for ACBS WorldCon, we are focused specifically on clinical behavior analysis. So I'm going to firstly just quickly review the learning objectives. This is what I'm going to be inviting our panelists to do today, to perform a functional assessment of clinical behavior as they're witnessing in a particular video vignette. And so behavior is ongoing. Context is constantly evolving and changing, and we as clinicians are a part of that context. So what we do has an influence on the client's behavior. So in the midst of this ongoing functional assessment, I'll be inviting them to propose a verbally based intervention. If they were in the room with the client, how might they respond to this bite-sized antecedent that's being presented in front of them? And I emphasize bite-size because they're going to be working with very limited context, especially in the beginning of the video. And then to relate their functional analyses to ACT and other contextual behavioral processes when it seems useful to do so. So very quickly, we can look at clinical behavior analysis as an application of Skinner's radical behaviorism that emphasizes verbally based functional analytic interventions for verbally competent clients. And this would be in contrast to ABA, or applied behavior analysis, which was in part developed for clients who are not as verbally competent. Forms of CBA can include, and I emphasize can because all of these models were designed with behavior analysis in mind, but they're not always practiced in that way. But they include ACT, or acceptance and commitment therapy, FAP, otherwise known as functional analytic psychotherapy, DBT, dialectical behavior therapy, behavioral activation, integrative behavioral couples therapy, and clinically applied RFT. Two assumptions of CBA include that the problems in a client's daily life can and do occur in session, and I would argue will at some point show up in session if you work with them long enough. And when that in-session behavior is functionally similar to that which is occurring in their life, there's an opportunity for direct assessment, for shaping of behavior, and for generalizing those new behaviors into the different contexts of the client's life. So for the format of our discussion, I'll be showing a clinical video vignette. So this is an actual soldier who is sharing about his PTSD following his combat time in Afghanistan. And so there will be some evocative content being shown in this video. It'll be paused at various points for the panelists to have an opportunity to comment on what are they seeing as far as the person's behavior in context. What are they watching for? How are they assessing what they're seeing? And if they were in the room with the client, how might they intervene in that moment? And then at times we'll be relating their analyses once again to processes of ACT and other contextual behavioral approaches. These are our discussants. So I'll be the moderator, and we have Emily Sandoz, Drew Carr, Matthew Boone, and Troy DuFrene joining me. I'm super delighted that they've all agreed to do this and happy to be here. And I hope you as the audience get something out of this panel discussion. So I'm going to stop sharing and turn it over to them now to introduce themselves briefly, and perhaps just share about what CBA means to each of you. Troy?
Oh, okay. I thought we were going to, we'd picked orders. So hi, my name is Troy DuFrene. I'm a clinical psychologist and behavior analyst. I probably by the time anyone sees this video, I will be affiliated with the Center for Compassion Focused Therapy in New York. I'm also affiliated with the San Francisco Center for Compassion Focused Therapy. And what to say? For me personally, I think the behavior analytic aspect of my work is more in the thought process than in the delivery. I think it's a way of organizing thinking in the treatment room around the observation of contingencies that are shaping behavior. And I also tend to think about the clinical interaction more from kind of an inner behaviorist point of view, as though the proper unit of study in the therapy room is in fact the interaction between patient and therapist.
Thank you, Troy. I appreciate you jumping in there. Others?
I'll go next. So I'm going to overlap a bit with Troy. Not in the first part, though. My name is not Troy DuFrene. It's Emily Sandoz. I am a professor at the University of Louisiana at Lafayette. I'm also the grad coordinator of our master's program. And I have a private practice, Camellia House Counseling and Testing. I do a ton of training, mostly actually in this model. So you'll get a little taste of what that's like. And as far as what CBA means for me, I'm a psychologist, I'm a BCBA, and the thing that I think about when I think about clinical behavior analysis is that we are directly assessing and instructing, directly assessing and training really the repertoires that we want to see. So for me, I think the work is about really building what I'm going to call appetitive learning repertoires, or the capacity for people to orient towards things that are meaningful and expansive and or pleasurable in ways that are sort of flexible and adaptive, and to do so in any environment, even when things are aversive, so or have traditionally been aversive. So for me, what I'm always looking for is the opportunity to sort of establish an appetitive functional relationship between me and the client, kind of a supportive therapeutic relationship, then to bring in stuff that's aversive, stuff that's difficult, that squeezes people down, gets them running, fighting, and hiding, and then adding to the context to build their repertoire. Like Troy, I probably draw more in a Cantorian behavioral or interbehavioral perspective. So the idea that everything in the context, all of those layers, all of the layers of the behavioral stream, that all of that is constantly interacting, which applied to the therapeutic relationship means that all of this is bidirectionally, interacting as the interaction unfolds. How many times can I say interaction in one sentence? So sharing that interbehavioral field perspective, which I think you'll hear in some of our comments throughout. The last thing I'll say about that is the important piece for me is that it's not about, for me, and I think this is an offering of clinical behavior analysis, that it's not about like learning new things under perfect conditions and then doing the hard work of generalization to bring those good behaviors out into the world. For me, it's more about bringing the world into the therapy room, and making sure that the work that we're doing is available to the client, that it's the context, the therapy context is appetitive enough that learning is flexible, but also aversive enough that it's actually going to matter out in the world. They're actually going to have access to those skills in the places that they need them.
Lovely. Thank you, Emily. Drew?
Hello, everyone. I am Drew Carr. I am also a psychologist, and I am I work at the Sierra Nevada VA as a psychologist. I have a private practice. I also get to teach often psychiatry students at the University of Nevada, Reno School of Medicine how to do therapy, which is really super cool as they're coming through the rotation. And I come to this work from a clinician perspective. And I love clinical behavior analysis because I think it makes what we do meaningful, present, and also can connect to all the other forms of the psychological literature possible. Like, it gives us a way to actually make sense of all these models that are interesting, but are all group oriented. So can we do it in a way that's flexible and adaptive to our actual present context as clinicians? And so I think our job is to help our clients basically have the most flexible repertoires possible. And so my job is to evoke all kinds of behavior in the room. And I want to see them be able to do anything that they want to do in their life. And so, like Troy and Emily, I do bring somewhat of a Cantorian perspective. However, I will also jump back and forth into a more traditional contextual behavioral perspective because I want to assess, like, is this particular thing working for them in lots of environments? And for many of my folks, they may not have acquired some of the skills that are necessary to even do things under aversive control to begin with. So I want to build them up in small, flexible, positive ways, maybe before I jump them into an aversive control situation. But regardless, I love this work because it allows me to be a context when another person's responding, and we get to really see how people change over time. And I think this allows for meaningful and deep work.
Nice. Thank you, Drew. Appreciate your perspective. Matt?
Hi, I'm Matt Boone. I'm a social worker. I'm an instructor in the Department of Psychiatry at the University of Arkansas for Medical Sciences in Little Rock. And I am the associate director of the student wellness program here, which is the bulk of what I do. I do counseling, psychotherapy from a ACT and broadly CBA perspective with students, people who are studying at this university, whether in medicine or nursing or any other discipline. And I like to train people in ACT. And I'm often training like the ACT basics, the 6 processes of the hexaflex and some of the ACT classic kinds of exercises. But I love hanging out in rooms full of people who use this vocabulary. And I try to bring little nuggets of this clinical behavior analysis wisdom into my training so that if someone learns something about ACT, they walk out thinking about the word function a lot. And maybe not even scared of the word context. And in my clinical work, I am always starting with the assumption that what I'm seeing is some version of something that happens outside of the room, and that I have a great opportunity to help that person practice doing new things in the presence of things that usually gets them running, fighting, and hiding, a bit of verbiage that I have totally stolen from Emily and use all the time now. So I love to see running and fighting and hiding in my office, and I love to help people build new resources in those situations. And I think that's what I'm doing every time I meet with somebody.
Yeah,
also, I learned clinical behavior analysis first by reading this book.
that verbiage is very catchy. I do love the running, hiding, and fighting verbiage. I also wanted to just quickly mention that Evelyn Gould was also originally planning to be a part of this panel discussion today and was unfortunately unable to make it, but she was an important part of this process and putting this together. And so I just wanted to quickly mention her before we move forward. So are you guys ready to jam?
Right.
All right. So I'm going to start our video vignette. And I'll be pausing for the first segment at about 34 seconds in, and then I'll give you guys a chance to comment on what you're seeing, how you might intervene, etc.
Okay, I don't want to go in detail, but I went through some pretty heavy combat in Afghanistan. Yeah, I felt a sense of guilt and, well, pretty much just guilt after I got back from it. Some guys, the good guys didn't, like most of the good friends, like, didn't make it home. So.
Okay, so short snippet there. And I'm curious as to what kinds of thoughts are coming up for any of you who would like to jump in first.
Well, I'll share. So there was sort of a little blip, and right before that blip, when he first started talking, the question showing up for me was, are there any feelings that you can name here, or is there an emotion that captures what's showing up for you here, something like that. Of course, he went on to name guilt specifically. What I think the next thing that I saw, and that links to the question that I would ask, is I felt like I could see him sort of physically contending with something, like I could sort of see in his body and in his face. It felt like he was reaching for some details, certainly a lot of distress present. So I'm curious about his capacity to sort of feel all that physically. I mean, he's contending with some memories, clearly, remembering some guys that he cares about, which I'm tucking away for later. But wondering, like, does that guilt show up physically for you, or where can you feel that guilt in your body? And my intention there is one of both, always for me, assessment and intervention. So is he able to sort of feel what's happening in his body, or are those feelings kind of, more up in his head, or more of a general sense of what comes with the memory, or can he actually feel sort of guilt show up? So that's the assessment piece. And the intervention piece is seeing how that functions when he does it, right? So as he, like, giving him an opportunity to do that, perhaps as a new behavior if he doesn't do it easily, and to see how it works when he does. So where does that bring us or lead us? Right. My understanding is that every time he engages in a behavior, the context shifts slightly. Every time I engage in the behavior, the context shifts slightly. So where does being with his embodied experience of guilt sort of bring us? Where do we land with that?
Well, there's a host of physical data sort of coming through, right? The brow tightly knitted, the kind of restless leg, you can sort of see him shaking off to the side. Begin wondering the sort of more complex behavior of actually presenting for services. What's affecting that as well? Gives the impression right from the go of someone who is fairly distressed right now, and we really haven't gotten into content yet. That's pretty interesting. Even then, just sort of more broadly too, I find myself wondering, is he's presenting in fatigues? There's even irrespective of the verbal content, there's a lot going on in that short little vignette.
Yeah, I was noticing in part, his stimulus control over me. That's one thing I'm often responding to a lot. And so he was presenting like very tight, under control, had so much stuff going on inside. He was responding to all this like learning history inside. And you can definitely see it as an article in his body. And I find myself wanting to draw into it and like lean into it. And I really wanted him to pause just for a moment, just to like be able to come in contact with just us being in the room together. Because I think even right now, he almost has all of this learning history that's showing up right now that feels like he almost is supposed to have a job. And I want him to almost have some permission in this moment just to be here, just to be able to be free to have a moment where he gets to have a breath. And I think, but I'm not fully certain where his skills are at this moment, if he has the ability to hold all this stuff in mind. So while I would want to ask him to tact to an emotion, I'd actually just first want him to talk to just, can we just be here? Can we just be here for a moment, you and me, figure out what we're going to do?
Thank you, Drew. Yeah. Guys, Matt?
I don't have a ton to add. I saw all the things that people are describing here as well. I'm also resonating with what Drew said about his stimulus control over me. Like watching what I perceive as someone in great pain often like evokes a particular response from me. You know, my private events are often like a little bit of softening. You know, I can feel the edges of my mouth kind of frown a little bit, and I'm feeling kind of sad. And then, you know, sometimes that's an occasion for me to like do things that are not sensitive to the client, and sometimes it's an occasion for me to do things that are quite sensitive to the client, right? But I'm in that space where I have this sort of like, oh no kind of feeling, and it's like, you know, that would be the first thing I was noticing was what was going on in me. And that something that comes out of me as an intervention will probably follow from that, whether it's useful or not for the client.
Yeah, I related to that softening, Matt, especially at first when, as Emily pointed out, there's this little blip where he's kind of hesitating at first. You know, is it safe enough to kind of go here? He says, I think, I don't want to go into detail. But then as he begins to open up, that's where I notice myself softening in response a bit, you know, just wanting to be present to that. All right. You guys cool to move forward? Thank you all for your responses. Here we go.
I didn't, the way I processed those feelings were, I didn't notice, but I would just go out and, like, I started drinking a lot, being angry all the time. And I just didn't do anything about it. I didn't think it was an issue because most of us just dealt with it. Like everybody else in my unit was dealing with it the same. So I didn't have any, like, that's just how I dealt with things. And how I dealt with things, just drinking and just feeling really angry and starting fights with people just for no reason. I didn't want anybody around me except the guys that I was with.
And so, in case you didn't catch that, the last thing he said, I didn't want anyone around me except for the guys that I was with. What's showing up for you guys here? Who would like to jump in?
I'll start. There's the same tightness of this repertoire that he's holding, and he almost can't even get out the sentences. It's like they're choking him off. And it's like, I can almost imagine it's either the experiences as well as a set of rules that he has in his head about what he's supposed to be sharing, you know, both as who he is and maybe what he's supposed to be doing, like all just kind of cutting it off right here. So there's a really big ass snake that's like in the room that's just telling us to stop. And if I was in this and assuming that, I would want to name it. I would want to be there and just to see like what else is here that's like not letting us go further. Like there's something that we can't quite touch. It's almost like a stove that we keep getting close to and we can't do it. So I would want us to talk about it and see if we can put some words around that. I might say something like, hey, I'm noticing in me, like there's something big here and I can't quite see it. And I'd like to see it from your perspective, like what's here.
I love that. Thank you, Drew. Others?
I'm like watching everybody to see if they're
After you, no, after you.
Right.
You go, Emily.
So I mean, there's a few things. Anytime I can see somebody remembering, I'm curious about how present the thing that they're remembering is now. So when he's talking about anger, I mean, a very kind of present, salient question for me is how much does he feel that anger now, or how much can he feel that anger now? if thinking about Drew, like I wonder if there's rules that say that anger is bad or that drinking is bad, that, you know, influencing or sort of present for him. So, you know, the question for me might be something like, how angry are you now? Or how close does that anger feel now? And I want to think about kind of being like really curious. So the idea that he might have some rules that anger is not good, you know, making sure that I am not, I guess, asking it in a way that sounds like anger is not okay. So real open, real curious, like how much of that anger is here with you now? Are you carrying a lot of that still? How close does that feel? I'm noticing, and I'll go ahead and name, that I use a lot of geographical metaphors. So a lot of kind of time and space metaphors. So, you know, over here, is that here right now? You know, the other, I guess, intervention that came up for me, and anytime people are talking about past things and I see them remembering themselves, I'm curious about how much space they have in context that make the self salient. So I'm wondering, like, what's his judgment of that guy today? The guy who's drinking a lot, the guy who's moving around pretty angrily through the world. You know, is he able to share with me his reaction to that guy as he remembers him with me today? And again, you know, it's intervention and assessment. So I'm assessing how much space does he have, you know, in memories that are both presumably fairly aversive, because we're seeing how constricted his repertoire is, and that are also kind of self-relevant, that make us self-salient. How much room does he have? You know, can he sort of interact with a self flexibly in that space? So what are your reactions to that guy? You know, do you have any more scaffolding? Would be something like, do you have any feelings towards him? You know, or I might even guess, like, you know, it looks like that you're remembering that guy unpleasantly, that version of you, with some distaste. Does that feel right as I say it? I'll pause there.
That's awesome. I appreciate the deictic framing there, in having him look at himself in the past. And actually, just a quick comment also on that, as far as temporally, I'm noticing that in the there and then, his behavior of drinking and fighting was normalized in the context of his fellow soldiers. But as he talks about it now, those functions have been transformed. Like, he's able to see it was normal then, but there's something, to me at least, as he talks about it now, that's been transformed in that.
Yeah, it's interesting, Lou. That might give us something, and I might not kind of lean in right at this moment, but that might give me something as like two contexts we could play with. Sort of, can you go into that space? Do you have access to that? Can you occupy the you that was moving around, sort of angry and, you know, and using alcohol in that way, you know, limited to just your bodies? Can he sort of move between that and also staying here and now, bearing witness to that version of him? Those might be two contexts that we could actually play with pretty readily in the room, inviting those two different ways of being with that memory.
Nice. Yeah, thank you.
And
Roy?
also while just acknowledging that, I mean, were this an actual interview, I certainly would not be opening my mouth at this point. But I do find myself curious about, you know, especially given like the physical presentation, whether that little snippet line about only wanting to be able to encounter this difficult stuff in the context of comrades, what it's like for him to be here, you know, talking about it, like how have we entered into this relational space together? And it speaks to some of the curiosities I was having before, like what's gotten him here? You know, is this something that had been mandated in? Is he struggling? Does he need help? How did we get here in the first place? And this would all sort of be coalescing for me right now.
I just wanted to comment. I was interested in, Troy, what you said, that you wouldn't be talking right now. I would definitely be not talking, but asking questions. I mean, yeah, 30 seconds is about how long I want to go before I'm asking questions.
I know I've consulted with you before.
So it's an interesting difference, in how it is. I think Troy and I both work from a very interbehavioral perspective in sort of, how it is that we use that idea of bidirectional functional relations. And, for me, the longer the client goes without me influencing the context actively, like in a way that I can track, and that I can move with intention, the harder it is for me to know the function of his behavior right now. So if I'm like sort of moving context and watching him respond, then I'm contextualizing his behavior with intention, and I can understand it more functionally. But also I am radical in my or extreme in my intention to process over content. Like the content I can sort of tuck away when I need it, but I'm like very, very interested in how this is all functioning right now and what he can do like right now in this space where these memories are here.
Yeah. Well, in point of fact, actually, I think the first question that would have occurred to me in that moment would have been around a sort of process disclosure, to sort of ask how that was talking about those experiences here. That probably, as I was just sort of checking myself through the timeline of the conversation, that's probably the first question I would have verbalized, I think.
I like that question because I think that we are, what I'm often doing when I'm first having a conversation with someone is I'm shaping up a repertoire of doing exactly what you guys are talking about, which is like content, talk, pause, notice, right? Name, respond in a new way, if that would be useful. And so I'm often thinking about that in the moment, but early on, I'm probably listening more and just setting the stage for that sort of thing. So that, for example, one thing that's occurring to me is that like, if anger is indeed a hard thing for him to experience in some ways, or at least hard to have and then not react to by doing something violent, like I would hope that we could set up a circumstance where anger could bubble up in the session and then we could practice doing something new. And if I was thinking in ACT terms, I might say like, how could he have anger, but also behave externally in a way that is values-based and that like helps build relationships if that's what he wants in his life, or helps, get something done if that's what he wants in his life, not fall into an old pattern that gets in his own way, like getting into a fight.
Matt, I just want to jump in really on that because it's interesting because I agree with so much of what you said, and yet you said, so I often use the first session and allow that space for these things to emerge. And I actually think about it very differently. And I think like, this is the first time I get an opportunity to start shaping the repertoire so that we can start having different contextual experiences over time. So I jump in pretty quickly to give him lots of occasions to practice new behavior, even right now, because I think this is the first time where he's getting a space to do that. And our relationship is going to be shaped as much by this initial learning history than from anything else. So that's actually why I give them multiple opportunities and jump in really quickly in these moments and say, hey, this is what we're doing. We want to do something like kind of cool and different than maybe what you've been doing within your learning history. And so that's how me showing up in the room might do that. And, also
I start with an assumption that it's likely that what they're doing is already new because they're in my office, and that I don't have to actively intervene for new behaviors to emerge. Although I don't know, I'm just making assumptions. I think I'm thinking in a longer game. It's like, I'm just going to listen for a while, and I'm going to listen in a way that people are probably not listening. And that itself is an intervention, like a contextual change for the person. And that might occasion new behaviors or useful behaviors emerging.
I've experimented with both ways in terms of like intervening soon and quickly versus taking a step back, just allowing some space, for the client to share, initially what's salient for them. And when I step back, I'll notice there are these missed opportunities along the way, and functions may be changing along the way too. as Emily was pointing out, it can be hard to kind of like, dig in at some later point in time when we've already missed like several opportunities along the way. And I do find if I intervene sooner, the session seems to have more life to it as well in intervening sooner. But then there's this part of me that's like, especially if I'm seeing someone for the first time, I also want to kind of see what they naturally do on their own. Like if they, if they're like lost in the there and then, are they on their own able to come back to the here and now voluntarily, right? Are they able to, to pick out little golden nuggets of values in the midst of very aversive circumstances? So I find that interesting as well, because I think there's value in that too. Oh, Matt, you're muted.
I'm thinking we should go to the next clip so
Sure,
that we have time to get to a few.
Let's do that. This next clip is very short, and we'll see if you guys have any commentary on it. If not, we can go on to the next one as well, but here we go.
No, and then when I got married, I started realizing that I had other issues, like sleeping. I wasn't sleeping good. I kept waking up at night, and my wife would try to talk to me, and I just wouldn't want to talk to her, and we started having like issues. So I think I realized a lot of things after I got married. I realized how messed up things have been with me, and
I'll just jump in by saying there's this interesting, like he kind of opened up a little bit, like he was talking a little bit more fluidly, it seemed like maybe this was an easier thing to talk about. And then you could see, at least what I'm assuming, was him contacting some of the pain attached to things not going well with his wife, and that him kind of deflating as he's talking about it, looking over to the side. And like if I was thinking in act terms, I would be thinking about, oh, there I see here perhaps values here, and I also see him getting kind of narrowed around something that's important to him, so that there's something appetitive here, something that he might want to work towards, but also something that's painful that gets him kind of knotted up. And so I'm just filing that away in my back pocket as something that might be a good place for us to go.
Yeah, the 10,000 yard stare and the echoed long pause after the word issues was like getting gut punched. that was the one thing that was like out of that little clip is he said the word issues, and then his gaze got very far away, and there was this long lull afterwards, which almost certainly needs follow-up.
I appreciate how, overall, like I view his behavior as somewhat constrained overall, and yet all of you are picking up on these very subtle shifts in his behavior, which I think I appreciate. I really appreciate how you guys are doing that, and admire and watching for these subtle shifts, that can cue us into functionally what's happening.
I'm so glad you said that, Lou. I just want to amplify it a bit and say that, one of the things when we are doing that, even if we're not calling it to the client's attention, but it is repeatedly occasioning our behavior. So their eyebrows come together and we pause them there. Their eyebrows come together and our eyebrows come together, whatever it is. Like as we're responding to those subtleties, they become more salient to the client, to the extent that we're varying our behavior contingent with their behavior, right? Even things that are quite subtle to them, right? Or things that from a Skinnerian perspective, we might call private. Some of your responses can be private even to you, especially if they co-occur with things that are aversive. So as we're responding to them, even if we're responding non-verbally, leading in, raising an eyebrow, changing the tone of our voice, certainly asking a question or pausing him, we're increasing his sensitivity to his own behavior. So yeah, I wanted to wrap some words around the intention we might have there. As far as the clip, some of my things that stood out for me is I sort of picture the client as handing me new aspects of context, like here we are now, and here we are now, and now we find ourselves here, almost like we're moving through a home, right? And then they hand me a candlestick, and I think, oh, it must be dark here. Maybe we're in the dining room, right? Or he hands me a book, and suddenly I know we're in the library, or another metaphor that I sometimes use is like the client is handing me paint, like here's some purple and here's some iridescent pink, and then I can paint the room and see what they can do. Right. So he mentions his wife. A couple of people have pointed out maybe that's a potential kind of appetitive, maybe it could be appetitive, or it is appetitive when he's not so hyper aroused. Maybe there's some possibility there. Maybe that's what got him here. For me, when he mentions wife, like he's handing me wife as a new bit of context that I can play with, right? And so two things come to mind with regards to what his repertoire may be able to do there, two sorts of possibilities for his wife as an aspect of context. One is, if we just kind of invite her into the room, how does his behavior change? What does he have access to? Presumably by this point, I've probed if he can tell me what's happening in his body, if he can name some feelings that are happening, if he can watch his mind go. And so when we introduce wife, then what happens, right? So if, let's say was able to before tell me what was happening in his body with guilt, the question might be something like, and as you mentioned, your wife, if we sort of let her be here for a moment, do you feel that in your body? Does that guilty feeling shift, or what happens in your chest, depending on where he named it before? The other repertoire would of course be sort of perspective shifting. I'm wondering if your wife were here now, remembering for me. Do you have a sense of what might be salient there? I would not expect that he would be able to do that today. In fact, both of those things might be more complex skills that I would not expect of him. But also trauma is a funny thing, and people can get really lumpy skill development, particularly when their traumatic experiences have been paired with training around being kind of hyper-focused and present, like some of our military have. So he may have some spots where he's actually really good at really narrow perspective taking, for example, or perspective shifting. So I would want to probe both that sense of, with your wife present, what are your reactions to her? What happens when she is part of the space, when the space makes your wife a salient aspect of context? And then, is her perspective available to you? So the introduction of that memory, the introduction of the wife as the paint he hands me, right, I can then paint the room and say, can you do either of these things?
Nice. Thank you. Any other quick comments before we move forward?
Just a really quick one. I thought this was a really nice example of a guy who does have all these tools that you can start to see, and then what happens really quickly when the context changes, and just you can watch how stuff just drops out. And this is just a great example of that, and how his world can change. And I think you can imagine that and how that impacts his life. And if you want to go that direction, you could do that.
Nice. All right. So next segment is about 50 seconds long, roughly. Here we go.
Yeah, that night I'll always remember the night that I guess was just a breaking point for me, that I decided to, like, hey, there's something really bad, like, wrong going on with me. It was a night I just got really, just like my way of dealing or coping was just not saying anything to anybody. It was just drinking. And I realized that just being here in El Paso, just a desert and everything, it just kept reminding me a lot of things. And not just that, we went to Vegas, so I just kept thinking about the mountains. It's just desert, like arid, so there was the whole time I was supposed to be having a good time, and I just didn't. I was just feeling comfortable around a lot of people.
So he's starting to kind of set things up here. He's talking about the night that I'll always remember, and he's kind of giving us some initial context for that night. What are you guys seeing here? What seems salient to you? And also just quickly mention that something about, he mentions being in the desert, and there's some that's getting related to his time in Afghanistan. So there's his time in Afghanistan, that context is present with him in the desert. And part of that, I imagine, is present with him as he's talking about this as well.
I now can't recall what the next words were after this, but there was one moment when his right eye kind of swelled shut. Like he sort of like seized around that. And I mean, you had sort of tipped the scene a little bit that there was some more major reveal coming up in the flow of the conversation, but that kind of facial temblor would also have been just like, and I can't actually say at this point like where I would have been verbalizing, but I definitely would have asked about that directly. That was such an atypical presentation for him, and as he was trying to get those words out, there was something that happened there, and that whole right side of his face kind of just went yeah, I again, really, I mean, some of my colleagues here would have maybe been thinking, different things. I'm finding myself being kind of intently curious to sort of hear where this is going at this point. But I think at this point I would probably be mainly receptive, but have noted that one particular thing almost as much as that gap after the word issues when talking about his wife.
I was noticing that.
Go ahead, Drew.
I was noticing that same part, and you can hear a quickening in his voice, and you can start seeing his eyes start to dot around. And I'm imagining it. He's unveiling, like, it's like the puzzle pieces of his life, and like, here's this one that I've just like turned over, and I know there's this thing over here, and I know I need to turn over it next. And you can kind of tell he's like so agitated. He's that part. What I'm actually concerned about here is whether or not he actually has the skills to fully like go to this piece in a way that's going to be adaptive to help him create new behaviors that are flexible in this moment. And so I would actually want to pause him around right here and just kind of set the scene and like reestablish like some appetitives for us to make sure that we're on the same place, that where he has skills and access to tools. Because what I'm worried about is when he starts to move this next piece over where he's about to go, that he's just going to get completely flooded and not have access to his repertoire. And so I would be pacing him right now, giving him new skills to practice. Can we do this now? Okay, you're with me. Here, this. Are you with me? Or are you so under this aversive control that you can't even see me in the moment to work with me? Because that's where I'm afraid I'm going to go. There, he's going to go.
I love what you're saying, Drew, because what I was going to jump in and say is sort of piggyback on trying to say, yeah, the content's really compelling right now. Like, I kind of want to hear the content, and I know that's like, and what you're talking about is making me think even more about like the content can be so compelling that you start being less sensitive to what's going on. Like, I'm so absorbed in the content that I'm not thinking what Drew's thinking, which is a really good thing to think about when you are working with someone who's relating trauma experiences, right? Hey, can we pause for a second before talking about it? Let's talk about talking about it. But like, my behavior, my therapeutic repertoire has gotten narrow because I'm like, what happened next? Right? Content became this thing that got me kind of narrow. In a way, it's like, Emily, you could probably help me put better words on this, but like, it's very appetitive to me, and it's appetitive in a way that gets my behavior narrow, right?
I would say that if it's narrowing your behavior, it's probably aversive. Not having the ending is appetitive is aversive, right?
That's what I need. Thank you.
The only thing I would add quickly, I'm kind of with Drew. Like, I'm worried. I don't want him. I don't want him to. So I said earlier, like, there's a sweet spot. Like, the space has got to be appetitive enough that learning is flexible, but aversive enough that it's going to matter. So you're kind of looking for this sweet spot. And I mean, most people, particularly if they've had to repeat this to, discharge or C&P, or compensation and pension, or, whomever, debrief, I mean, whomever, you can get this repertoire where they just sort of will drop out in whatever way, they're completely running, fighting, or hiding, even as they're talking through, even as they're sharing feelings, stuff like that. So I'm very likely here to say, like, can I pause you? I feel like I want to offer you a breath. I'm wondering if we could just give you a couple of breaths here. Watch and see if that's resourcing to him. So I'm looking to resource it out a bit. And if he can't be responsive to that, we might just even hang out outside of the door of it for a little while longer. So some of the things that I offer, we would think of as like flexibility skills. And some of the things that I offer are, we need to open this up a bit. If anything that we do here is going to be functionally running, fighting, or hiding, because we're getting smaller and smaller and smaller. And I say we intentionally, right? Because if my assumption is that there is like a parallel process. If the whole field is narrowing, then we are both experiencing aversive functional relations.
Yeah, when I think of flexibility here, I'm thinking even in terms of his body, just like, can we get a little bit of movement here with his body in a way that, he feels safe enough, to kind of continue going forward here, whatever that might mean to him. But I'd like to, in this moment, kind of pause and do a little bit of resourcing as well in that regard.
Well, and we can even check and say, so now, like if we see him responsive to that, we could even check and say, does it feel like a choice to finish this story? Or, we could ask him, is this something you want me to have going forward? Because like, I want him to know that he doesn't, in order for us to work together, he doesn't have to tell me about the night today, right? So sometimes we might just ask, does this feel like a real choice? Does this feel like something you just want to hurry up and get through? Like I can cooperate with you on either. And I
love that question. Does this feel like a choice to you to continue here? Because we don't know his learning history, as you pointed out, Emily, who he shared this with before, what his expectations are in sitting with a therapist, presumably, like what he's supposed to do, what rules are present there, right? I think that is an incredibly important intervention at this point in time.
You're here.
You guys ready? All right, so this next segment is a bit longer, so this is going to be 2 minutes.
So one night at a hotel, I just was drunk and angry. Then I started watching war movies. Like, that's the way I used to dig into stuff. Just go start watching war movies. Like, then I started watching a really bad war movie, and it reminded me of just, I got really freaked out. I just had this feeling on my chest that it's just like before you get in a fight, like that feeling that everything tightens up, and I felt that and it wouldn't go away. So I tried to drink it off. Maybe then I'll fall asleep or something, and it just didn't help. It didn't help, so I just went into I just looked at myself in the bathroom, and I was just pale, and I don't know, I felt really scared, like really bad, and I couldn't get rid of that feeling inside my chest. So I did probably it could have been worse. Thank God it wasn't, but so I just had a beer in my hand, chugged it, broke the bottle on the sink, and I started just being really angry at myself. I felt a lot of guilt and anger, and that feeling wouldn't go away, so I just like slashed my chest like really bad. Multiple times at first time, and then I just kept going and trying to get rid of it, and then I guess I just felt more concentrated on the pain that I was from the cut than anything else. So then I just, I was thinking about ending it right there, but I don't know. I guess if it wasn't in my right senses, if I would have been more, or if I would have had the means, I probably would have taken my life.
What's showing up for you all? What are you guys tuning into? You know, just a quick comment, something I just caught for the first time here, because I've seen this video before, is I noticed that he shares the consequence of his behavior before he shares the behavior. He says something, it could have been worse. Thank God it wasn't, before he shares what he did. I just thought that was interesting. That just caught my attention.
I mean, I can share. I mean, you know, there's a couple of things that were really salient for me. I mean, one, I have like a felt sense of holding space. It's hard for me to articulate, but you know, what I am doing at that moment is like trying to swaddle him with love. You know, like just like I am picturing him looking in the mirror in a shitty hotel room in Vegas, and like the kind of anger that you have to have flooding through you to like actually, like it's such a like I want to say like bold, and I don't necessarily mean with positive connotations, but it's such a brutal like interaction with yourself. You know, to imagine breaking the glass and then cutting himself repeatedly in the chest. So I am, you know, picturing that as if I am where the mirror is, and you know, yeah, just trying to love the heck out of him there for a few. Upon him stopping, I think I would want to like acknowledge seeing him and thanking him for inviting me into that, you know, space. I would be trying to manage a bit more like how much of my affect was in the room, maybe more than I am now, because I don't know how that might function for him. But
Yeah, I like the language of smother with love. Like that speaks really well to like what I was noticing my own arousal, you know, just that there was this like swell of emotion listening to him, and you know, wanting to like it's like this is something that I'm drawn toward, is people sharing these moments with me. And that's a moment where like again my reactions, I don't know the client well enough at this point probably to know whether like if my affect shows on my face, if that will be like a moment of like a useful piece of context to offer him, or if like it's better in that moment to like keep it to myself because it might be safer for him and it might prevent him from closing down. I don't know. But what I'm most in contact with is that swell of emotion as he tells this story, and putting myself in that position and imagining how alone it must be, and how painful whatever those emotions must have been, that cutting himself was a relief in a way. At least I'm interpreting it that, because this is I can pay attention to the pain. So yeah, it's very there's an emotional swell for him, but it's happening for me too.
Yeah, it seemed like the physical pain was more repetitive than the emotional pain in that moment for him. And I'm just noticed for myself, and I noticed that swelling coming up too, both during the video, but then also as Emily was doing this perspective taking of imagining being there in the moment in front of the mirror. Like I noticed the emotions swelling up in me. And I'm just thinking to myself, if I was with him in this moment, I just want to be fully present and attentive and just, want him to know that I am here with you right now, and I also do love the intervention of swaddling him with love, and I appreciate the word swaddle in particular, because it has, like, I think of a baby, and kind of, swaddling a baby who's crying in pain, having yearnings, having, just really just needing love in that moment.
All that, and I noticed myself having a similar reaction to what I always have when someone describes some kind of non-lethal self-injury, which is trying to imagine what his history has been disclosing this before. And you can see for sure that this is very slow going for him. He's slowed way down. He does have this right eye tell. His right eye keeps like squinching back and forth. So, that's going to be something to watch for. He continues to do that when things get hard for him. I'm a bit concerned now that whatever I project to him is going to reassure him that there is no judgment or dismissal about this. This is hard for him to say, and my experience over time has been that people, when they do disclose this kind of experience, they get a lot of negative pushback from civilians, and maybe even from professionals too. I feel somewhat endangered right now, that I don't want to project the wrong anything that's going to like push in the other direction here. And I also sort of I'm now reflecting, while I think anyone in this business is going to have these responses, I'm kind of wondering how he would receive that. He may not have a long history with receiving love, with receiving compassion. This may not land that way. And I'm finding myself being concerned in some sense that if I were to kind of lead with my gut in that regard, is that going to feel condescending? Is that going to feel dismissive? Does he have enough history with sort of receiving love for that to feel like a good move at this point?
Yeah. So I'm noticing the time. Drew, did you want to add any quick comments before we wrap things up for our discussion?
He was hitting on where I was going to go, so it's a lovely bit.
Okay.
Good Lord, has that been an hour already?
It has, yes. So if you're watching this, thank you so much for being with us in this panel discussion. Thank you so much to our panelists. I appreciate you all being here with me on this journey. Really benefited from the discussion.
Well, and if we could acknowledge you, Lou, for this iteration of a piece of work that you've been carrying in the World Conference for a couple of years now. Thank you so much for bringing us together. And also thank you to Evelyn, who I could hear in like multiple one of our comments. So, they were certainly here, even if not physically present. So thanks.
Thank you.